Hi, everybody. I'm just watching the the numbers of participants going up, so I'm just going to give it a minute until the numbers stop rising. But lovely to see so many people joining us. Okay, good morning and welcome to the Annual Audit 2026 webinar. And for those of you who haven't met me, I'm Sarah Davidge. I'm Head of Membership Research and Evaluation at Women's Aid. I'm very happy to be chairing today's session. If we can just move on to the next slide, just talk a little bit about what we're going to do today. In fact, we're going to be hearing from colleagues across the research evaluation and policy teams at Women's Aid today, talking about the findings and recommendations of our latest annual audit report, which was published last month. We will have some time for questions at the end, and you can use the Q&A box to submit questions as we go through the presentations. To let you know, we will be recording today's session and uploading it onto the Women's Aid website for those who weren't able to join us today. Before we begin, I've just got to say that please be aware the recording and distribution of the webinar and its contents are not allowed without permission from Women's Aid, so please get in touch if you want to share. Can we move on to the next slide, please? And I'll just talk a little bit about the methodology behind the report, but you can read the full methodology in the report. This is the 2026 edition of Women's Aid's annual publication on the provision, usage and work of domestic abuse services in England, and it examines the financial year from 24 to 25. We've used our administrative data sets, On Track and Routes to Support, as well as our annual survey and some freedom of information requests to local authorities. On Track is Women's Aid's case management and outcomes monitoring system. The national data from this represents the experiences of over 200,000 survivors supported by local domestic abuse services across England. Routes to Support is the UK-wide online database for domestic abuse and other violence against women's services, and it provides details of the services available throughout the UK, including up-to-date refuge vacancies. The annual survey is distributed to all domestic abuse services that are listed on Routes to Support in England that run refuge community-based services or both. This year we received responses from 128 organisations who were running 221 of the service entries on Routes to Support. That gives us a response rate of 53.5%. The report also draws on a freedom of information request, which was sent to all 317 local authorities in England, and 315 of those, all but two, responded to us. This year's report is the first annual audit since the publication of the cross-government strategy to build a safer society for women and girls, following Labour's Welcome Election Manifesto commitment to halve violence against women and girls, VOG, in the next decade. The annual audit presents one-of-a-kind factual data, including current demand and levels of service provision for domestic abuse services, which are key. There's key data in monitoring progress against the VOG strategy and this commitment to halve VOG in 10 years. The strategy also committed the government to a radical transformation of the commissioning landscape, acknowledging, we think, the short-term, fragmented and dysfunctional commissioning landscape domestic abuse services are currently operating under. Through freedom of information requests distributed to all local authorities across England, we've gathered data on how many services are commissioned, demonstrating the need for this reform because many services are operating on partial or unstable funding, particularly within our buy and for services. The VOG strategy emphasises whole system change so survivors can better access housing, health and justice, and a mission to drive the systemic change in the response to domestic abuse across society by strengthening accountability and improving multi-agency responses. The Annual Audit 26 explored domestic abuse services experiences with local partnership boards, with multi-agency working, and the accountability mechanisms across local authorities. The findings suggest that whilst formal partnership structures are in place in most areas, their impact is uneven, where specialist domestic abuse services feel that their expertise is undervalued or their input doesn't meaningfully influence decisions, the effectiveness of the wider system is weakened. Prevention is a core pillar of the government's VAUG strategy, and within this area, online abuse is rightly recognised as an escalating and serious form of VAUG that criminal justice agencies have a poor understanding of. New forms of tech-facilitated abuse continue to emerge. Alongside, it's important to note, digital tools that can be used by survivors to protect themselves. The annual audit explores frontline services experiences of supporting survivors around tech-facilitated abuse. And whilst most services report confidence in safety planning, it does appear their ability to support survivors with these issues is restricted by how tech devices operate. So emphasising that device manufacturers have a responsibility to consider safety allowances in their design and operation. The audit also explores how services are responding to wider social and political development, including far-right rhetoric and riots, and the impact of international humanitarian crises, which is shaping survivor experiences and placing additional pressures on frontline services. We've structured the findings in this report into the 5 sections you see on this slide: demand, provision, funding, collaboration and accountability, and emerging trends and issues such as the far-right rhetoric and tech abuse. We're going to hear about the key findings in each of these areas from members of the team at Women's Aid. So to get us started, I'm going to hand over to Senior Research and Evaluation Officer Emma Clark, who is going to talk us through some of the findings in the demand chapter. Emma.
Thanks for that, Sarah. So as Sarah mentioned, I'm going to talk through the first chapter of the report, which is using the best available measures on the prevalence of domestic abuse and our national data sets to understand the demand for specialist domestic abuse sector. So there is currently no definite national measure of demand for domestic abuse services, and the available data often underestimates or hides the gender nature of domestic abuse. The Crime Survey of England and Wales from the ONS is the best available measure of national prevalence, and using this data alongside population estimates, we saw that just over 2 million women and 2.4 million children experienced domestic abuse in the year ending March 2025. And although we know that not all of these survivors will need or want access to services, we do know that women and children are more likely to experience significant and harmful impacts from domestic abuse and require access to life-saving support. So, for example, women experience higher rates of repeat victimization. They're more likely to be seriously hurt, and are more likely to be killed by a male partner or ex-partner than male victims of abuse. And women are also much more likely to experience coercive and controlling behaviour from male perpetrators. To better capture this gendered nature of domestic abuse and coercive control, Women's Aid and partners supported the development of new questions in the Crime Survey, which was used for the first time in the ONS by the ONS in this year's survey. So these questions clustered survivors into 3 groups, depending on the types of abusive behaviours perpetrated against them and the impacts of these abuse. And these abuse scales showed that women experience significantly higher rates of domestic abuse in clusters 2 and 3, which indicate medium and higher numbers of abusive behaviours and impacts than male victims. And for partner abuse specifically, women were over 3 times as likely to experience higher numbers of abusive behaviours and impacts. And also new research from Sylvia Walby and colleagues has also demonstrated that the Crime Survey's methodology of capping the number of violent offences against the same victim creates a sex bias within the survey and further underestimates violent crimes against women and the gendered nature of domestic abuse in the ONS data. So from all of this, we can see that there are higher levels of demand for life-saving interventions of refuge and community-based services by women survivors of domestic abuse. So how many women were supported by the specialist domestic abuse sector? Using our on-track and Routes to Support national data sets, we estimated that 10,665 women and 11,732 children were supported by refuge services, and 138,955 women and 180,642 children were supported in community-based support services across England in the year ending March 2025. So comparing these estimates with the crime survey prevalence data, this means that only an estimated 7% of women and child survivors were supported by refuge and community-based services. So as I said before, we know not all of these women will require access to refuge and community-based services. Our research also showed that demand for these services continues to outweigh available levels of service provision, and this has been a particular issue for refuge services this year. So our estimates showed that 65.2% of referrals into refuge were rejected in the year ending March 2025, which is an increase of 5.1% since the previous financial year. And this makes it the highest proportion of rejected referrals nationally since the financial year 2019 to 20. And the most common reason why these referrals were rejected was because the refuge did not have the space or capacity to accept the referral. So this accounted for 42.7% of all rejected referrals. And this includes where a service could not accommodate the support needs of a client, such as around mental health, drug or alcohol use, or if the client had no recourse to public funds. So measuring the demand for the specialist domestic abuse sector is essential for understanding how current levels of service provision are meeting the needs of survivors, but also for monitoring the government's commitment in the VOG strategy, as Sarah mentioned, to halving violence against women and girls in 10 years. The government is measuring this commitment by aiming to halve the overall prevalent rate of domestic abuse of 11.3% by 2034. However, as we can see in this report and from our research, that this overall measure does not tell us the whole story about domestic abuse or demand for support services. Thank you. I'll hand over to Nat now to talk through the next section of the report.
Hi everyone, thanks so much Emma for breaking down the national data on demand. I'm Natalie, I work on the Routes to Support team at Women's Aid. I'm going to be talking about the provision section of the annual audit. As Sarah mentioned already, that Routes to Support is the leading online directory of services for women and girls affected by domestic abuse and VOG. The data in this section is largely taken from Routes to Support and is supported by on-track data and data from the annual survey. So I'm just going to dive into some of the key findings from this section. So number one there is that refuge bed spaces are still at a shortfall compared to the Council of Europe's recommendations. So there was a slight increase of refuge bed spaces between 2024 and 25, an increase of 68 refuge bed spaces, and the total came to 4,619 as of May 2025. But despite this, the nationwide refuge bed spaces are still 19.9% lower than the recommendation of the Council of Europe. So the government VOG strategy has committed 499 million over the next 3 years to support the safe accommodation duty to enable local authorities in England to provide the support victims need in safe housing. It is important to note, however, that this funding sits within a broader homelessness, rough sleeping and domestic abuse grant, meaning that councils can spend the funding on homelessness, rough sleeping and or domestic abuse support in safe housing. Although it's vital that refuge bed spaces are increased, we know from our research that domestic abuse services face broader structural challenges that impact their ability to meet demand. So in particular, as our safety to stability report found, the length of time survivors spend in refuge is increasing due to barriers to sourcing move-on accommodation, meaning that refuge bed spaces become available less frequently. Survivors will continue to be turned away from refuge until these structural challenges are addressed. So another key finding was that vacancies on the system on Routes to Support were still lower than pre-pandemic levels. So again, there was a slight increase of 303 vacancies posted on Routes to Support in the year 2024 to 25 as compared to the previous year. with a total of 7,853 vacancies posted. So this was the first year since the COVID-19 pandemic that the number of vacancies has increased since the previous financial year. But despite this, the levels of vacancies posted on the system have still not recovered to pre-pandemic levels, So another key finding was around vacancies that are available to women with no recourse to public funds. So the data shows that having no recourse to public funds remains a significant barrier to accessing refuge. So only 11.5% of vacancies in 24 to 25 could consider a woman with no recourse. The government VORG strategy acknowledges that insecure immigration status may prevent survivors from coming forward to report domestic abuse, but it's clear from our research that more must be done to ensure that survivors with insecure immigration status, particularly those with no recourse to public funds, have access to practical and life-saving services such as safe accommodation. It's also important that services understand that some survivors with insecure immigration status do have the right to access public funds. Our research from 2022 has shown that survivors with insecure immigration status may sometimes be misunderstood as having no recourse to public funds, therefore limiting their access to support to which they are entitled. So another stark finding from this section is around vacancies available to wheelchair users. So again, the VORG strategy acknowledges disparities in support for groups such as disabled adults, and also notes that this group experienced significantly higher rates of domestic abuse and sexual assault. Our data clearly demonstrates this, showing that just 1.1% of vacancies in 24 to 25 were suitable for wheelchair users. Another key finding was around the decrease in refuges running dedicated CYP services. So our data showed that the number of refuges running a CYP service decreased by 11.6% in 2024 to 25. So one more thing that came out in this section was around additional support needs. So we can see from comparing on-track data on the support needs reported by survivors entering domestic abuse services and the specialist support services listed on routes to support, that there are gaps in meeting demand for specialist services, particularly around mental health. So on-track data shows that the most reported support need for survivors was mental health. This is registered by 44% of survivors accessing community-based services and 52.8% of survivors accessing refuge. So in comparison, just 8.4% of community-based services and 11.5% of refuges had specialist support workers for survivors with mental health support needs. So to conclude, the key findings from the annual audit related to service provision showed that refuge stations remain at a shortfall, that vacancies available to survivors with no recourse to public funds and wheelchair users remain extremely scarce, and that there has been a decrease in refuge services running dedicated CYP services. The VORG strategy has acknowledged many of these challenges, and it's clear that these barriers to the recovery of survivors, and in particular the significant barriers to the recovery of marginalised survivors, must be addressed. I'm now going to hand over to Simran, the Research and Policy Officer, to talk us through the funding section.
Thank you, Nat, for providing us with a breakdown of our national data on provision. So now we'll turn to funding and talk through some of our key findings. So at least 1 in 8 refuge services receive no local authority commission funding at all. It's important that we recognise here those 13.3% of services which continue to run and support survivors and the sector despite not receiving local authority commission funding. Refuges run by and for Black and minoritized women were less likely to be commissioned by the local authority, with 42.9% of IMCON member refuges being fully commissioned compared to the national proportion, which is 72.4% of all refuges. While we advise caution when making comparisons, since we began reporting on the commissioning status of IMCON member refuges, this is a consistent finding that there have been significant variations year on year between IMCON member refuges and the national proportion. And overall, between 2024 and 25, this meant that almost 3 out of 4 refuge services were commissioned by the local authorities for all of their bed spaces. But it's worth noting this doesn't mean that funding is substantial. When we ask services what their local authority commissioned funding provides for, only around a third, and that was 36%, received funding for all support staff costs. So that's staff salaries, clinical supervision, and training. We also found that almost 2/5, 39.1% of organisations were providing an area of their domestic abuse support without any dedicated funding. And of these organisations who ran an area without funding, 42% relied on volunteers and 22% closed or reduced part of their service. So the data this year indicates that more services in the sector are operating on partial or unstable funding. And while many organisations continue to sustain provision through reserves, volunteer labour and diversification of income, this model isn't sustainable in the long term. Most concerning is the impact on survivors of a reduced capacity to support them if they present with more complex needs. And we know this will likely affect the most vulnerable survivors, where those with multiple intersecting support needs require additional support from services who hold expertise in how this impacts their experience of domestic abuse. And so there's a strong link between a lack of funding and survivors being turned away as a result. And so far, we've discussed how demand for domestic abuse support services outweighs current levels of service provision, particularly for refuge services. And by asking services and submitting freedom of information requests, we were able to determine that inadequate funding continues to undermine the sector's ability to meet demand. If those non-commissioned spaces were not available, then the level of refuge shortfall in England would increase by around 10%. So it's currently 19.9%, and it would increase to 29.8%. And ultimately, this means some services have a much better chance of survival than others. There's a downward trend of commissioned services, and this year, a notably higher number of services defined as partially commissioned. And this suggests to us that there's a greater reliance on diversified income streams and provision of bed spaces that they're not actually commissioned for. And to put this into further context, the VORG strategy recognised the short-term, fragmented and dysfunctional commissioning landscape and committed the government to a radical transformation of the commissioning landscape, but it didn't commit to ring-fence funding for buy and for services. So there's an ongoing concern now, especially for the most marginalised survivors and the services that are in place to support them. And that's a summary of our funding this year and the kind of national picture of commissioning. Now, Phoebe, our Senior Research and Policy Officer, will discuss our findings in relation to collaboration and accountability.
Thank you, Simran. Okay, so the government Violence Against Women and Girls strategy sets out a mission to drive systematic change in the response to domestic abuse across society by strengthening accountability and improving multi-agency responses. As part of this, they are exploring options to introduce a statutory duty to collaborate to ensure agencies work together seamlessly to manage risk and prevent harm. Findings from the annual survey presented in this section highlight the need for this reform and provide valuable insight into what current accountability mechanisms are effective and where the gaps are. We found that whilst most specialist domestic abuse services are represented on local partnership boards, confidence in their decision-making, accountability mechanisms and oversight remains limited. With only just over half of services agreeing with the statement, the local partnership board in my area delivered effective decision-making during 2024 to 25, and only 11.4% strongly agreeing with this. Open-ended responses in the annual survey provided further insight into issues regarding the effectiveness of the local decision-making of local partnership boards. These fell into three main categories: inconsistent approaches across different local authorities, lack of strategy or planning, and power imbalances, as demonstrated in the first quote here, which discusses how lots of multi-agency meetings often feel very local authority heavy, Concerningly, less than half agreed with the statement. The local partnership board in my area improved conditions for survivors during 2024 to 25, and only 10.1% strongly agreed. Less than a third of respondents agreed with the statement. The local partnership board in my area improved commissioning of specialist domestic abuse services during 2024 to 25, and only 10.1% strongly agreed. The government's Vaughan Strategy Action Plan outlines an intention to embed a coordinated approach through improving collaboration between frontline professionals, ensuring they properly understand and respond to risk. Within this proposal is the commitment to develop new guidance on best practice for effective multi-agency working, with a clear focus on the multi-agency approach to domestic abuse. This guidance will set out key principles and what good looks like in responding to domestic abuse. When it came to multi-agency working, services reported mixed experiences, including ongoing power imbalances between statutory agencies and specialist providers, lack of transparency in commissioning and governing processes. We also asked respondents in the annual survey to share good examples of multi-agency working in their local area. Some respondents noted improvements in statutory responses to survivors who were working in a way which demonstrated increased domestic abuse awareness. Many of these responses explicitly discussed how improvements in relationships between specialist domestic abuse services and agencies had directly improved collaborative working and resulted in better outcomes for survivors. When we asked about the barriers to effective multi-agency working, responses fell into 5 main categories. Inconsistent responses, and that could vary across kind of different local authorities as well as different staff members, resource constraints and silo working, power imbalances, and lack of recognition of specialist domestic abuse services, limited domestic abuse knowledge by statutory agencies, as well as conflicting priorities compared to kind of statutory agencies and domestic abuse agencies. We asked respondents in the annual survey what accountability mechanisms were in place in their local area to ensure the effective delivery of domestic abuse services. Most respondents were able to provide details of where they could feedback issues or concerns in their area. Examples of these mechanisms included local partnership boards and other multi-agency forums such as MARAC, along with commissioning reviews, regular reporting, and domestic homicide reviews. However, only 11.7% felt that accountability mechanisms in place in their local area were very effective for holding the local authority to account for decision making, and just over a third said somewhat effective. These findings further highlight the need for a coordinated approach to domestic abuse across different agencies and the need to engage with the specialist domestic abuse sector on what good practice and effective accountability mechanisms look like. So next I'm going to talk about our last section, which was emerging trends and issues. Prevention is a core pillar of the government's Violence Against Women and Girls strategy, which prioritises interventions aiming to disrupt misogynistic attitudes and stop dangerous behaviours from escalating. Online abuse is rightly recognised as an escalating and serious form of violence against women and girls that criminal justice agencies have a poor understanding of. In this section, we explored emerging trends and issues impacting the domestic abuse sector, including the use of AI tools, new and emerging forms of coercive control through digital tools, the impact of the 2004 summer far-right riots, as well as international humanitarian crises. Almost a third of services reported that they had a written AI policy in place or were in the policy of developing one. Services reported mainly using AI for sectorial reasons, such as summarizing meetings, minute taking, as well as funding and benefit applications, research and reporting to funders. And the most common forms of technology facilitated abuse disclosed to services were online stalking, compromising social media profiles, misuse of GPS trackers, and non-consensual intimate image sharing or threats of. And the most common form of technology-facilitated abuse identified as new to services experience in the past year was coerced participation in OnlyFans or other online activity. The majority of services either agreed or strongly agreed that they were able to sufficiently safety plan around technology-facilitated abuse. However, they are restricted by how these technical devices operate. Services reported the following impacts of the far-right
We're having a little bit of an issue with Phoebe's internet connection. Bear with me and I will do my best to pick up where she left off. Oh, hold on, bear with me. So, I think the last thing that Phoebe was saying was that the majority of services, almost 2/3, agreed or strongly agreed that they were able to sufficiently safety plan around tech facilitated abuse. However, they were restricted by how those tech devices operate. Services reported the following impacts of the far-right riots in summer 24, an increased demand on services, increased discrimination and direct racist abuse experienced by survivors, having to close offices or cancel appointments, and ongoing concerns on survivors' willingness to seek help. Services reported increased need to support women affected by humanitarian crises, particularly migrant survivors, alongside a greater emotional and practical burden on frontline staff responding to trauma outside of their usual remit. The findings demonstrate that specialist domestic abuse services are operating within an increasingly complex and rapidly shifting context. The gradual adoption of AI tools reflects operational adaptation, particularly in administrative and communications functions. However, this shift also highlights the need for clear policies, ethical safeguards, and ongoing consideration of risk in sensitive service environments. The impact of the far-right riots and international humanitarian crises demonstrate that services are not only responding to domestic abuse, but also to trauma linked to these contexts as well. Whilst the VORG strategy sets out to decisively safeguard young people by making the UK one of the hardest places for children to access harmful content and misogynistic influences online, it disappointingly does not acknowledge the ways in which VORG is being weaponized by far-right politics, or how hostile environment policies are exacerbating VORG experienced by migrant women. There is a need to acknowledge the evolving landscape, placing additional responsibilities on frontline services and the importance of flexible, informed and trauma-responsive practice in meeting survivors' changing needs. I'm going to hand over now to our Senior Policy Officer, Isabella Daly, to talk us through some of the Annual Audit 26 policy recommendations, and we will endeavour to get the slide back for you. Over to you, Bella.
Thanks, Sarah. I'll now take us through some of the key recommendations for government and local authorities in the annual audit report. These recommendations stem from the report's key findings and are therefore grouped around each section of the report. The full set of recommendations can be found alongside the annual audit report on our website. So the first set of recommendations focus on demand and are centred around expanding bed space capacity and support, increasing capacity through timely move-on accommodation, and preventing further strain on the sector. Thanks, Emma, for sharing. As the annual audit report shows, there is a widening gap between the scale of domestic abuse and the capacity of specialist services to respond. Therefore, increased spaces and capacity are essential to enabling domestic abuse organisations to provide their life-saving services to as many survivors as possible. For example, we recommend that MHCLG provide resources to pilot a move-on hub for survivors of domestic abuse, which will facilitate pathways to move on accommodation and establish a workable business model that enables specialist services and housing providers to deliver both move-on housing and ongoing support. It is also essential that new initiatives, like the Steps to Safety initiative, do not place additional pressure on already overstretched frontline services. Next slide, please. The next set of recommendations are focused on provision. We know that there is limited provision available for marginalised survivors. Therefore, we recommend prioritising and strengthening the infrastructure of specialist provision for marginalised groups to ensure that specialist domestic abuse services are adequately resourced to provide their vital range of support to survivors from marginalised groups who do not always receive the appropriate responses from statutory agencies. This includes by ring-fencing funding for specialist domestic abuse services led by and for Black and minoritised women, deaf and disabled women, and LGBT+ survivors within wider allocations. Other provision recommendations are centred around protecting community-based support during the transition away from police and crime commissioners, or PCCs, investing in evidence gathering to strengthen responses, and strengthening family justice responses to alleviate pressure on specialist services. The next slide, please. The annual audit report shows that more services in the sector are operating on partial and unstable funding, as Simran mentioned earlier. While many organisations continue to manage provision through reserves, volunteer labour and diversification of income, this model is not sustainable in the long term. We therefore recommend that ring-fenced funding for survivors is protected to provide stability for the sector and to enable the delivery of safe, high-quality and equitable provision. For example, we recommend that the Home Office addresses the need for emergency grants for survivors at the point of fleeing by investing in the long-term continuation of the flexible fund beyond 2026. As part of this, the Home Office should engage in longer-term discussions with the Department for Work and Pensions as part of the government's VORG strategy work to ensure that the welfare system is adequately equipped so that survivors have the financial means to flee. Next slide, please. As key findings from the report show, the impact of formal partnership structures is uneven across areas, and services continue to report low confidence in existing oversight mechanisms. We therefore recommend that commissioning styles are reformed, including by enforcing existing guidance and strengthening oversight. For example, we recommend that MHCLG, in partnership with specialist organisations and commissioning experts, strengthen statutory guidance for local authorities in relation to Part 4 of the Domestic Abuse Act 2021 and develop a more robust mechanism for accountability. These recommendations are important in ensuring that commissioning practices include specialist organisations and recognise their expertise in domestic abuse, as well as in enabling improved collaboration and effective multi-agency working overall. More robust and transparent accountability mechanisms are also essential in holding local authorities and statutory agencies to account and improving overall outcomes for survivors. And next slide, please. Lastly, our recommendations for emerging trends and issues cover a wide range of areas. We know that the operating environment for specialist domestic abuse services continues to evolve rapidly, both as a result of technological advances and broader political and social developments. Our recommendations are therefore centred around sector-specific AI guidance, ensuring technological platforms are held accountable, countering harmful narratives, and providing guidance on survivors' rights. All of these recommendations are essential in enabling specialist domestic abuse services to meet demand for support and to feel confident in their safety planning and in supporting survivors to safely seek help. I'll now pass back to Sarah.
Thanks, Bella. Thanks to all our speakers today. That does conclude our presentation part of the webinar. We now have some time for questions. If we're unable to answer all the questions during the session, we will share responses afterwards. So please do put any questions that you have for our speakers into the Q&A or the chat, and we'll come to them. Okay, let me have a look. Phoebe, are you back with us?
I am indeed.
Excellent. Lovely to see you again.
Yes, and I'm sorry. I think my name is Hannah at the moment on my screen, but I am Phoebe. Apologies about the technical issues, but hope you managed to get to the end of my section.
Perfect. I've got a question for you, if that's okay. Just bring you back in. How can local authorities encourage better multi-agency working and collaboration?
So that's a great question. As I discussed in the collaboration and accountability section, we did ask domestic abuse services for some good examples of kind of multi-agency working. And one thing that kind of came out in particular was identifying where there were kind of communication gaps across kind of different agencies and encouraging better communication between them. Also kind of wanting to hear directly from survivors themselves. That was something that was identified that often led to better outcomes for survivors. And another thing was working to kind of ensure consistent responses across different staff and different agencies across the local authorities. So particularly sometimes organizations felt that sometimes they get a really good response from particular staff members, but the staff members, sometimes would leave and move on, and they'd have different responses from different ones.
Interesting. Thank you, Phoebe. I've got a question for Nat. Just on this is to do with demand and provision and the refuge shortfall figure that we talk about. Can you just explain how that's calculated, please?
Yeah, no worries. So we use two different figures. So the refuge bed space data that we get from Routes to Support. So that's a really nice, accurate figure, we hope, that's updated regularly. So we get a good, accurate figure of how many refuges and how many bed spaces there are across the country. And then we combine this with the ONS population estimates. So the Council of Europe recommends one refuge bed space per 10,000 people in the population. So we use those two figures to calculate the shortfall.
Thank you, Nat. So I've got another question for you guys. So we talked about mental health needs being particularly pressuring in the refuges and creating issues. I wonder, and perhaps this is one for Sim, can you elaborate on that a little bit for us?
Yeah, sure. So, I mean, in terms of refuges receiving referrals and assessing women, the way I've interpreted this question, at least, is around women, being rejected because their support needs are too high. So it could be that upon assessing that woman, that refuge has established that they are not equipped or resourced in the right way. So for example, a woman might need more support than the refuge can provide in their like standard working hours. So some women might have really high mental health support needs and need a 24-hour staffed refuge, and those are actually quite rare. So yeah, that could be a reason, or it could be that actually, with the overlap of her mental health support needs, there needs to be the presence of a specialist mental health team, and that's not necessarily something a refuge might have. Some do have specialist mental health trained workers, but not all do. And of course, as demonstrated earlier in the webinar, just the support needs can be much higher, and they can't adequately support, and it would be unfair to take the woman in knowing that. So yeah, I hope that answers the question.
Thank you, Sim. Yes, that's really interesting. So I've got a question about move-on accommodation. I think there's two parts to the question. The first is about whether there's any further findings or guidance on sanctuary schemes as a form of safe accommodation, which I'm not sure that that is something that the report has explored. But also, is there any more information about the move-on support from refuge back into housing? I think perhaps not necessarily in this report, but there's another report that we've done about move on accommodation recently that might be useful. Is anybody able to, Emma, perhaps share a bit of information about that report?
Yeah, thank you, Sarah. So yeah, a report that we published earlier this year, we looked at how refuge services were being impacted by lack of move-on accommodation, and we saw that the length of time that survivors are spending in refuge has increased by an average of around 50 days over the past 5 years. And then this is having significant impacts on survivors' experiences in service, but also on the refuge services themselves. And obviously, it just means that access to refuge is becoming even more difficult because bed spaces are just becoming available less frequently. So there's just fewer available bed spaces, which is a trend we're continuing to see. Which Nat sort of talked through in the provision section of the audit, looking at the shortfall in bed spaces, and also the number of vacancies in bed spaces is lower than pre-pandemic levels. So yeah, the sort of lack of access to move-on accommodation is definitely a trend that's continued over the past year.
Thank you, Emma. That's really helpful. I am going to put a question with me. Sorry, opening lots of boxes. A question to Bella about the recommendations next. You talked about a Move On Hub pilot that we're recommending to MHCLG. Are you able to give us a little bit more information about thinking around that?
Thank you, Sarah. So we're still in quite initial thinking around that pilot itself. So there's no more specific information at this stage that I could share about it. But yes, again, the overarching aim would be to ensure that pathways between refuge and move-on accommodation are more resourced, and that the transition itself is able to occur more seamlessly and ensure that it's survivor-centred and that survivors' needs are put first. But yeah, we're still at quite initial thinking of that, so unable to share any more specific details at this stage.
Thank you. I'll just come to one more question and then we'll see if there's anything else that the panel would like to add. The question I've got, have you found that there's been an increase or perhaps better awareness of demand for the LGBT plus community support? Nat, is that something you'd be able to come in on?
Yeah, I can't comment on demands for LGBT plus community support. It is something that we track in terms of provision on routes to support. So we have on the system where there are specialist services that are exclusive for the LGBT Q plus community, and also whether any services on the system have specialisms in that area, so like a dedicated project or specially trained staff members. I think it is, I would say, like maybe an underdeveloped area. That sounds not what I'm trying to say, but that there probably is like a much greater demand than we see on the system. We know that that members of this community are like very, very likely to experience domestic abuse. So I would say that the demand probably does outweigh the provision at this stage. So unfortunately, I'm not able to comment on the awareness of demand, but yeah, we do track it on routes to support.
Thank you, Nat. Yeah, I know it's a problem that we have measuring demand across the board, isn't it? And particularly with sort of minoritized groups, where if the provision isn't there, we don't see the demand. So if there's not a refuge vacancy there, we are not monitoring how many people are applying for that vacancy. So the lack of provision masks some of the unmet needs. So it's really important that we always qualify that we haven't necessarily been able to measure the full extent of unmet demand because the sector is under-resourced. I'm just going to come back and see if anybody wants to come back in on any of the questions that we've had so far, add anything else. Okay. Okay, in that case, I'll just have a quick look and see if we've got any more. That's all the questions that we've got for now. So we will close the webinar there. Thank you ever so much, everybody, for attending. You can see on the slide that we've got up now, we've got some links if you want to access the information that we've shared, access the report itself. If you do womensaid.org.uk and look for our research section, you can find all about us and what we do, and you can also find information about our national quality standards on our website too. Thank you again, everybody, for your time and your engagement in this session, and we hope to see you at future webinars. Thank you very much.